Every year, thousands of little kids end up in the emergency room because of a cavity. Not because a cavity is an emergency by itself, but because by the time anyone notices, it's already causing real pain, and there's no dentist in an ER to fix it. So what if a dentist could stop that same cavity in seconds, with no needle, no drill, and barely a whimper? A new nationwide trial says that's already happening. Tooth decay is the single most common chronic disease in American children, more common than asthma, more common than allergies. It affects over 4 in 10 kids in the US. And a cavity left untreated doesn't just sit there quietly. It can spread into the nerve, cause swelling and infection, keep a child up at night, and eventually mean missed school and a trip to the operating room, where a young child may need to be put under general anesthesia just to fix a baby tooth. For families without easy access to a dentist, or for a toddler too young and too scared to sit still for a drill, the standard fix has always been a hard one to get to in time. That's the gap a strange-sounding liquid called silver diamine fluoride, SDF for short, is built to fill. A dentist dips a tiny sponge-tipped brush into it and paints it directly onto the cavity. The whole thing takes seconds per tooth. No drilling out the decayed part. No numbing shot. No sedation. No tears in the waiting room. It sounds almost too simple to work on something as stubborn as a cavity, which is exactly why, even though dentists in other countries have used it for decades, the United States never had the large-scale proof to back it up. Here, it's only been available off-label since 2014, technically approved just to ease tooth sensitivity, not to treat decay itself, which meant plenty of dentists and insurers stayed cautious about using it at all. That changed this year. A Phase 3 clinical trial led by the University of Michigan, published in JAMA Pediatrics, followed 830 children younger than 6, recruited through dental offices, pediatricians' offices, and Head Start programs across Michigan, New York, and Iowa. Every child in the study already had severe early childhood cavities, the kind that would normally mean a filling or worse. Researchers applied SDF to some of the decayed teeth and compared them against a placebo, repeating the treatment every 6 months, then carefully tracked what happened next. The study actually began back in 2018 and pushed through years of pandemic disruptions to get here. It's the kind of large, carefully controlled US study that regulators actually pay attention to, not a small pilot program, but real evidence from real dental chairs, funded with more than $12 million from the National Institutes of Health specifically because officials wanted a definitive US answer. The results: SDF stopped tooth decay in more than half of the treated baby teeth. Not slowed it down, stopped it, with nothing removed and nothing drilled. The lead researcher, Dr. Margarita Fontana, called it a very effective and safe treatment, even in children as young as 1 year old. And because the whole application takes seconds and needs no anesthesia, it works especially well for exactly the patients who struggle most with traditional dental care: toddlers, older adults, people with disabilities, anyone with serious dental anxiety, or anyone who simply can't get to a dentist chair easily. So what's actually happening inside that tooth? 2 ingredients are doing 2 very different jobs. The silver acts like a targeted assassin for the bacteria causing the decay. It disrupts their cell walls, jams up how they function, and stops them from multiplying, including the specific bacteria most responsible for cavities in the first place. Meanwhile, the fluoride sinks into the tooth itself, helping rebuild a tougher, more acid-resistant mineral structure in the enamel and den, similar to armor plating bolted over the weak spot, drawing in the calcium and phosphate the tooth needs to patch itself. Kill the bacteria, harden the surface, and the decay simply stops advancing where it is. Here's the honest catch: SDF doesn't make a cavity disappear, and it isn't a cure-all. The treated area turns permanently black or dark gray because that's the silver staining the dead, decayed tissue, a visible trade-off families have to accept in exchange for skipping a drill. It also isn't meant to replace every filling. For some kids, it's a way to control a cavity until a baby tooth naturally falls out on its own. For others, especially adults, it may buy time until a full restorative procedure is affordable or possible. So, the end of drilling, as intriguing as that sounds, isn't quite here yet. But for an awful lot of cavities, drilling may no longer be the only option. This trial matters beyond one study, because SDF has been stuck in a kind of regulatory limbo in the US for over a decade. Legal to use, but never officially approved specifically to treat decay, which makes some insurers and clinics hesitant to adopt it widely. This is exactly the kind of rigorous, large population data the FDA needs to consider approving SDF as an actual cavity-treating drug, not just an off-label workaround. Researchers on the study say that approval could mean better insurance coverage, more consistent products, and dentists and even pediatricians reaching for it far more often, catching cavities years before a child ever sees a dentist's chair. SDF isn't new. It's been quietly doing this job in places like Japan since the late 1960s, decades before most American dentists were allowed to reach for it with any confidence. What's new is that the US finally has the hard evidence to trust it at scale for exactly the kids and patients who've had the hardest time getting cavities treated at all. Toddlers too young to sit still, people with disabilities, anyone whose fear of the drill has kept them out of the dentist's chair for years. So maybe the more honest question isn't whether drilling is over. It's how many painful trips to the ER, the operating room, or the dentist's chair could have been skipped for decades